As the economy grapples with the impact of COVID-19 on business operations, experts are asserting that diseases such as malaria have cost the economy much more. Besides the huge monetary bill, experts believe that it is still hard to attach a price to the human and other costs related to the disease.
Right now, the reality is 40% of people who visit the health facility in outpatient clinics come because of malaria. I want health workers to imagine that if we deal with this problem, their workload will reduce by half. And therefore, they should prioritize prevention. And the long lines, the waste of testing facilities, the waste of medicines can be addressed by this big decision.
The impact of the disease, however, gets bigger, looking at its effect on the economy's critical sectors that are beyond health.
For example, we have been very concerned the way COVID has hit down tourism. But malaria has consistently kept some tourists away from here. Okay, the five-star hotels have made sure their air conditions and mosquitoes cannot get in. Some of the tourist camps provide repellents for those who want to camp out, who want to sit on the campfire. So how do we, other sectors, gain major interest in this?
It is at this stage that government is reaching out to the private sector in the fight against malaria.
So I think that private sector has got a role to play. Number one, in the first few years, we've got to raise awareness. If everybody's aware, it's not so much about money, because people think it's about money. In the last 1 year, the last 9 months maybe, a lot of attention has been moved from other diseases to COVID. Everybody's looking at the coronavirus and looking at COVID. So our malaria has begun to slowly creep up, especially amongst pregnant women. They're not being checked properly, young children, because everyone is worried about putting resources behind COVID. And it's unfortunate.
Indeed, the health ministry is now casting the net wider, focusing on involvement of all major stakeholders as it pushes towards elimination of one of the major killer diseases, but also a source of cost for the country and its partners.
We want to extend our intervention beyond what we have been doing, but we go deeper up to the household level. And also involving all other players that were not initially involved in, but we believe that they have a role to play. The political heads, the policymakers, the private sector, the community. So all that, that framework that brings together everyone to take the responsibility of ensuring that they contribute to elimination of malaria.
This push is driving towards prevention, with experts now noting that besides helping in saving lives, the huge treatment resources, it can also offer a good platform towards ensuring a malaria-free Uganda.